We are so excited to finally be on location for the first time at one of NeuroSpa TMS locations to finally see firsthand how this therapy is really affecting and changing lives for people with depression and anxiety. Dr. Nate Upshaw, it is great to see you finally in person.
I'm glad you guys could make it out.
I know, it's been more than a year and I can't believe that it's taken this long, but I'm really anxious to see how this works. We've talked about it so much. Right now, we'll start here. I'm sitting in the chair in one of the rooms here, and it kind of feels like I'm at a dentist office in this chair. Can you walk me through everything that this chair does?
Yeah, so you're sitting upright in the chair, but like a dental chair, the head goes back a little bit, the feet go up so that you're comfortable. And then the actual treatment coil is here, and this delivers the treatment. Very small magnetic field that targets specific areas of the brain that are out of sync in people who are depressed and anxious. It's not painful. The whole procedure is actually pretty comfortable and tends to make people feel relaxed and like their mind is more connected and more focused after treatment. So most people actually enjoy coming to get treatment, unlike the dentist.
My dad's a dentist.
And
I'm
my
not
wife's
going to
a
let
dentist,
him.
so I know,
really?
yes, exactly.
We won't show them this.
Yes,
we won't
exactly.
show them this. So each treatment takes about 20 minutes, right?
Yes.
And absolutely no side effects.
There's no side effects. So this is really the future of psychiatry. Anything that you would take a medicine like Prozac or Zoloft for, especially depression, OCD, those are the things that are FDA cleared, but it tends to help also with anxiety and insomnia for people who are depressed. And so there's no side effects, and it's targeting directly the circuits that are out of sync in depression and anxiety, whereas medications hit those circuits, but they hit the rest of the brain and the rest of the body as well, and that's where the side effects come in.
Some people take this on top of a pill, right? And some just do this therapy?
Right, so most people who come to us are coming through insurance. This is approved by insurance. Every major carrier, including Medicare, covers this. And so people have tried some treatments. Then they come here wherever they're at. If they're on medicines, they just start right up with this. And if they do well, a lot of times they're able to reduce or get off of their medications. So this works in combination with the medications. But again, when it works well, people are usually able to reduce or get off of the medications.
And then how often do you see some patients come in? I know that it probably varies from person to person.
So where things are right now with TMS is that it's approved by insurance and you're issued 36 sessions. And so most people use all 36 sessions because they're feeling better and they want to go ahead and use them all. Most people come 5 times a week, but some people come a little bit less if they're having practical concerns with work and things like that. But the average person comes 5 times a week, Monday through Friday, and they use their 36 sessions. And we have a really good response rate, a little bit higher than the national average. You have about a almost 80% chance of getting significant improvement, and then about 50 to 60% of people actually go into remission, meaning that they're feeling much better than they have usually in years.
You know, mental health is so prevalent. I'm glad that the stigma is being dropped a little bit over the past several years. More and more of us are talking about how we're affected by it, either personally or through family members and people close to us. I'm sure you have countless stories of your patients sharing with you how this has changed their lives.
Yeah, the great thing about this is this represents a brand new chance to get a remission. So once you try a medicine and it doesn't work, the chance that the next one or the next one is going to have a different home run effect is really low. Same thing with psychotherapy. So a lot of people have tried a lot of psychotherapy and meds, and if it didn't work for them, the chance that the next medicine was going to do something is low, whereas this has a brand new chance to give someone a remission. And so that's the cool thing, is seeing people who have been struggling for years with all types of treatment come in here and go into remission with this treatment.
Yeah, I mean, it can give someone a completely new outlook on life. I'm sure it's really rewarding to see that.
Yeah, this treatment is very exciting. Again, it's been FDA cleared since 2008. And I was lucky enough to get trained on this back in 2010. So I've been doing this for over 10 years. And we're very excited now that it's accessible through all insurance. So that really, this is a very mainstream treatment, even though a lot of people still haven't heard of it.
I have to tell you, before we go to the office here, it has such a calming feel, and I'm sure that was done on purpose. You know, it's very quiet, and I'm sure it can get really relaxing in here during the treatment as well.
Yeah, we really want to kind of revolutionize the way people think about mental health treatment. The name of our company is NeuroSpa. We want to create a spa-like atmosphere. This doesn't have to be something that's stigmatized. since there's no side effects, is almost like you can think about it like a rejuvenation treatment. Your brain is just getting optimized. We also check people's labs. We do CBT therapy, nutrition groups. So we really have a full complement of services that we do while people are in treatment with us. So it's more trying to optimize your mental health instead of thinking of the old type of like stigmatized mental health treatment.
Dr. Upshaw, it's great to see you.
Thanks for coming out.
Thanks for having us out.